from the NewsChannel 5 network. This is Open Line.
Hello, everyone. Welcome to Open Line. Glad you are with us tonight. Talking about a very important topic. Talking about the Delta variant, coronavirus and that Delta variant. What is it doing here in Tennessee? And where are we with vaccination rates? What can we maybe expect from the Delta variant and the coronavirus and vaccinations going forward? Happy to have with us here in person somebody who can help explain all of that, Dr. David Aronoff, Director of Infectious Diseases at Vanderbilt. Thank you so much for being here.
Thank you for having me on.
You've been on via Zoom, and now we can be in person. We're a little farther apart, but still in person, so that's great. So I'm glad you're here. All right, Delta variant. Where are we right now? Delta variant aside, coronavirus, here in Nashville, here in Tennessee, where are we right now?
Right now, we're in a pretty good place. The pandemic's not over, but disease activity in Tennessee is fairly quiet. Hospitals are not full of COVID patients. The number of cases we're diagnosing every day across the state is low. We're not done yet, but we're in a place that I think gave people confidence to be getting back together, and we certainly saw that recently over the July 4th holiday.
July 4th was astounding. I mean, what we saw downtown made me think, okay, this is totally over. I mean, it was beautiful. It was beautiful to see all those people together. It was also a little startling. But how many people there were not vaccinated, do you think? I mean, if you go by statistics, there's a large number. And what do you think that means?
Yeah, I mean, on the one hand, it's great seeing people back together again. It's great to see our economy booming, and we're a city that thrives on entertainment. But the reality is COVID is still spreading. About 40% of the population of Tennessee is vaccinated, and so it's possible that 60% of the more than 350,000 people who got together weren't vaccinated. And as a physician who's been really involved in caring for patients with COVID through this pandemic, my thinking is I hope there weren't a lot of transmission events, and if there were transmission events, which there probably were, I'm really hoping that that doesn't translate into our hospitals filling up again or people getting sick, and even one person dying of COVID-19 is one more person too many.
What are we seeing in some other states? Is there anything we're seeing that concerns you?
Really good question. Across the United States, disease rates really since January have been on a progressive decline. But here very recently, we're starting to see rates of disease go up. And in fact, in states not very far from Tennessee, Missouri, Arkansas, and Florida, we're seeing pretty high rates of disease being diagnosed in the population. And we're seeing reports of hospitals whose ICUs are filling up again with patients who are struggling to breathe with COVID-19. And these are not the kind of stories that we want to be seeing this far into the pandemic when we have effective and safe vaccines available.
When we have, you said nearly 40%, I think it's at 38%, but let's say 40% statewide vaccinated. It's higher in Davidson County, but if 60% across the state are not vaccinated, where does that lead us? Is it possible that many of those people have been exposed to the virus and we're going to continue to see these numbers go down? Or if we stay at where we are right now, 40% get the vaccine statewide, what do you think that means?
Well, I think a few things. First of all, it's unlikely that we're going to end up at any time in the near future back where we were in late December, early January, because there are many people in the state who have already had COVID-19, and 40% of the population or so are vaccinated, and that's really, really helpful. But we are starting to see case numbers start to creep up. They're still low across the state, but they're starting to head in a direction that's upward and not downward. Clearly, the Delta variant that we've mentioned is spreading across the United States, including Tennessee, so we really do have to have our guard up that we could start to see real increases in people in the hospital, people on life support, or people dying at a time when we have the ability to prevent that.
And let's say somebody got COVID. They got COVID I don't know, end of last year, beginning of this year, and they haven't gotten vaccinated. And they say, I don't need to get vaccinated because I had it and I have the antibodies. What do you say to that?
Well, they're not entirely wrong. In fact, for people who have had symptomatic COVID, they have immune protection against getting infected again. Now, the extent to which they're protected against some of these newer variants is not entirely clear. And it's highly variable how protected people are because the clinical presentation of COVID is highly variable. So people who had very mild infection or were asymptomatic tend to have very weak immune responses to the virus. That's different from the vaccines. The vaccines really train our immune system against the most important part of the virus that's required for it to cause infection. And we're clearly getting data showing that these vaccines protect against the common variants that are spreading in the United States, including the Delta variant.
So the Delta variant is the one we hear about the most. To be clear, this vaccine protects you against the Delta variant. Is that right?
That's right. It's important for people to know that regardless of the variant, the vaccines aren't perfect. In other words, you can be vaccinated and still get infected. But here's the things you need to know. One, it's harder to get infected if you're vaccinated. Number two, if you get infected and you're vaccinated, you're much less likely to get symptoms or end up in the hospital or die from COVID-19. And number three, if you're vaccinated and you get infected, you're less of a threat to other people because you're less contagious. You shed less virus and you clear the infection from your body more quickly. And those things are true whether you're infected with the original strain that emerged in early 2020 or one of these new variants.
How concerned are you that a new variant will come along that will not be, the vaccine won't work? Is that possible? Do we run that risk? The Delta variant's not that, right? But is it possible, and how concerned are you that there will be a variant that the vaccine doesn't protect against?
Well, this is one of the reasons why we need to look at this pandemic as what it really is, which is a global problem. And there are places in the world that are raging with COVID. In fact, there are over 60 countries right now where the rates of COVID-19 are increasing, not decreasing. And we're having trouble getting vaccine to all corners of the world. And those are the conditions that could allow new variants to come out, and they may be more resistant to the current vaccines. But right now, we're not seeing those variants. And what we are seeing are variants that the vaccines do protect us against. And the best thing that we can do to protect the people of Tennessee, in Davidson County, or across the country is really to create a human shield to this virus by getting people who are eligible vaccinated.
What do you think about this fall? So right now, you know, summer's in full swing. We had a huge 4th of July. We have a lot of people traveling. The other thing everybody's thinking about is this fall when we all go back to school and Titans will be playing. Are you concerned that if the vaccination rates don't go up, that this fall could be hampered in some way, or are you not concerned about that?
Well, I'm most concerned for the people who are not vaccinated. So let's take the example of a big football game, lots of people there, and disease activity has increased, not as bad as it was in the wintertime, but it's still active in our area, and someone at that football game gets COVID and dies. That's really concerning and preventable. Right now, the way things are in Tennessee, pretty low with disease activity, we'd be pretty comfortable having outdoor sporting events. But if we look to some of our neighbors, Arkansas, Florida, Missouri, they're heading into those situations where we may have to think about curtailing big social gatherings if a sizable fraction of the population's not vaccinated. So if we want a fall that looks as good as we really deserve, we need to get more people immunized.
What about schools? And specifically younger kids. There's a certain age, right, that's not even eligible to be vaccinated. Do you think there will be a vaccine for those younger kids when school starts? How concerned should parents be if there is no vaccine? What about that?
Well, we've learned a lot about how to keep schools safe, and I have every confidence that we'll be able to have in-person schooling in the fall. First of all, the staff and the teachers, any adults who are eligible for getting vaccines should do so. We really do need to protect as many people as are eligible. That includes adolescents, that includes young adults. And for the youngest ones who can't get vaccinated, we may, depending on disease activity, need to still have them wearing masks in the classroom. We still may need to look at distance between students in the classroom. But we've clearly learned that if we use a lot of different protective measures, we can have safe in-person schooling, and the vaccines are only helping with that. So I remain optimistic, and I do think we're going to have safe and effective vaccines for the younger children. I just don't know that it'll be in time for the first day of school. That seems unlikely.
The most rural counties are the counties where we're seeing the lowest vaccination rates. And more rural counties, there's much less density, obviously, and you don't come in contact with people. How concerned are you by these lower vaccination rates of just like 28% in a rural county, 70, 80% of people not getting vaccinated? How concerned are you by that? What might that mean?
Well, I'm concerned, and I have to say I spent the last weekend in rural Tennessee talking to people at a town hall about their concerns about getting vaccinated. These rural counties aren't islands. It's not a little community where nobody leaves. These are people who came to Nashville for 4th of July celebrations, and they may bring more than their good experience watching fireworks home with them, and that could include COVID-19, which could then end up in a person in their community who gets sick and isn't near a big hospital and maybe struggles to get to a hospital and ends up in a bad way because there wasn't protection in their environment. And so one of the best things that we can do across the state to keep people, even in rural Tennessee state, safe is to get vaccinated.
It's interesting to me you were in rural areas talking about this. So what did you find? Do you feel like people are opening up to the idea of getting vaccinated, or have they kind of closed the door on it? What did you encounter when you were out there?
Well, it's important to know that the people who come to a town hall to talk to me have questions that they'd like answered, and they probably are really depending to hear those answers to make a decision. So I don't think that I saw a lot of people who were very entrenched in absolutely not getting immunized, but the questions that I got were great, and they were the kind of things that we know are common questions about the safety of the vaccines, about whether if somebody has a particular illness they should get vaccinated, and age groups and various things that people could bring back to the people they live with or the people in their religious communities or work environments. And I'm hoping that that information helps people have confidence to roll up their sleeves, get vaccinated, and then carry on.
So it's been reported about a political divide over vaccines. This is probably not news. And what I thought was very interesting, in the Tennessean, they did some investigation, and it said counties with the highest levels of support for President Trump in the 2020 election generally reported the lowest vaccination rates. And that's the indicator that is most likely will show how a county is going to go. How did they vote? How concerned are you by that? What do you think about that?
Well, the one thing that this virus has shown us is that it doesn't ask what somebody's political affiliation is before it seeks to infect them. And what I know is if somebody is immune, it's harder to infect them. And if they're immune and they get infected, they're less likely to get sick. And those facts are immutable. That doesn't matter if somebody's voting in this way or voting in that way. And so a lot of the role that we in public health and physicians and nurses and others have is to meet people where they are and say, what are your concerns? Why aren't you comfortable getting immunized? And how could we maybe help change that, independent of anything political? Because again, this virus doesn't care how people vote, but it can certainly cause disastrous outcomes in anybody of any political persuasion.
So this is a great opportunity. You can call the doctor here on Open Line and ask any question you may have. And I have a few calls here. We're just going to go to the phones, and I appreciate you coming on. Let's go to Steve. Is that right, Steve? Lee? Lee. Okay, not Steve. Lee, go right ahead.
Hello?
Hello, Lee. Go right ahead.
Okay, yes, this is Lee, and I appreciate you taking my call and the topic as well. What I'm concerned with is I've had the shots, and I'm 67 years old, and I have a lot of medical issues, and, I have stroke, stuff like that. But what I'm concerned with is with this virus, this COVID virus, is my daughter got the virus back in Colorado, but she had no symptoms except for a little tiredness, and she never has gotten the shot at all yet. She's going to college at Belmont Nursing School, and I want to know what effect her not getting this shot affects me with this new virus or the variant. And that's really what I was calling. I'm going to hang up, and I'd like to listen. And,
Lee, thank you.
Appreciate you taking it.
Yes, sir. Thank you for the call. What do you think about that?
Well, first of all, Lee, thank you for calling in. Your question is actually a pretty common one. Part of the question is about if you've already had COVID, should you get vaccinated? And we sort of talked about this a bit, particularly for people who had very mild symptoms to their initial infection. They really may have had a very mild immune response, which may not be fully protective if they get challenged again, or if they get challenged by now a more contagious variant of the virus. So it's hard to say with confidence, Lee, that your daughter's past mild infection is really giving her the degree of protection that would maximally benefit her if she gets exposed. And knowing that you are in a high-risk group, even though you're vaccinated, knowing that she's in nursing school and maybe around people who are susceptible, I would really be a strong champion to say get vaccinated, because that vaccine will boost the immunity that you got from the infection and focus it on mounting a response against the business end of the virus, that spike protein of the virus that essentially acts as the Velcro that allows the virus to stick to our cells and cause infection. And the vaccines really train our immune system to block infection from happening. So, Lee, I appreciate your call, and I hope that that answer is helpful.
And, all right, there are more questions. All right, so just to be clear, and I know you answered this, but he's vaccinated, so he's done everything he can do. If you're vaccinated and yet there's someone in your house who's not vaccinated, how concerned should you be? How likely is it that a vaccinated person, even if they're living with somebody who is not vaccinated, could get sick?
That's an awesome question. Lee did the right thing. Lee got vaccinated. So Lee's chance of getting sick from COVID-19 is greatly reduced now that he's vaccinated. Because he's over 65 and has other health conditions, that risk is not zero. And so if I'm living with Lee, he's 67 and has medical conditions, I'm going to want to do what I can to really further reduce his risk. And I'm going to do that by getting vaccinated. But certainly the fact that he's vaccinated helps a lot.
Good. All right, let's go to Michael. Is that right, Michael?
Yeah, Mike, how you doing?
Mike, okay, go right ahead. Go right ahead, sorry.
Hey, no problem. Good evening to the doctor as well. I always have been told when things are going awry in a household or a business, corporation, you should always look to the leadership, to the person at the top. That person is Governor Lee. And right under that would be the Commissioner of Health. I forgot her name, but I think we all know who she is. Bill Williams Wood from your network got the governor to, basically ask him, don't you think you bear any responsibility? He dodged the question every kind of way he could, but I still say that he is ultimately, Governor Lee is responsible. Now, I have the latest data. This is just 11 hours ago. Tennessee is still in the top 10. 51, Mississippi, Alabama, Arkansas, Louisiana, Wyoming, Idaho, Georgia, West Virginia, Utah, and Tennessee. Most of those states are in the South. Most of those states are governed by Republican governors with a majority of Republicans in the legislators, in the state legislators. What is it about the South? What is it about us that we refuse to look at science And the second question I have for you, I wanted to know if the Davidson County Health Department had any booths or kiosks set up on 4th of July down there for the fireworks display, which would have been very helpful to get a lot of people to get them their shots. And I'd like the answer to all of those, especially where this responsibility lies. And I'll hang up and listen. You guys have a good night. Thank you.
All right, Mike, thank you. A lot there. I don't know. Did they have booths? Do you know, were there booths down there?
I wasn't down there, and I don't know.
I don't know. That's a good question, Mike. That's a good question, and we don't know the answer to that. All right, what is it about the South? That's his other question.
I mean, it's very complicated. We touched on this a little bit. We've clearly seen across the country that, and in Tennessee, that how people voted correlated with their readiness to get immunized. And, you know, while I know that the virus doesn't share any political view and is non-discriminatory in terms of how people voted, at this point, the virus is finding it a lot easier to infect people who don't have any immune protection. And so I would just make a plea that if you're out there and you're not vaccinated and you're eligible, remember these are free vaccines, they're safe and effective, and it's really important to get vaccinated. And I think the point that Mike is making is that in the southern part of the United States, vaccine rates are lagging, and we're starting to see disease activity increasing, particularly in some states around Tennessee, Florida, Missouri, Arkansas, are even seeing some communities where hospitals are starting to fill their intensive care units with patients struggling with COVID-19. And at this point, there's so much that we can do to prevent this infection. We can still use masks and social distancing, but even more important is that we can get people immunized. And so what I like to think is when we're given the opportunity to lead in our household, to lead in our community, to lead in our workplace by rolling up our sleeves and getting vaccinated, we really should be showing that leadership.
When you were out talking in more rural communities about this and urging people to get vaccinated, what you said you heard a lot of questions. Do you think what was holding people back was concern about side effects, concern it may not be safe, or is it some political thought that this was all overblown and is not really a big deal? Could you get a sense? What did you sense when you were talking to people?
There was predictably a little bit of all of those things. There were the young folks who felt like, if I get COVID-19, I'm not going to get very sick from that. There were people who felt like, I've heard that these are not safe, or there were people that were concerned that the vaccines appeared on the scene very quickly and they must have taken shortcuts. And so almost any concern that we've heard anywhere came to be valid concerns at these town halls in rural Tennessee. And that gave us a good opportunity to educate, to remove some of the mythology, but we're doing that one town hall at a time, which is slower than I would like. And that's why I'm so happy that we have Open Line and we have places that have a bigger reach and can listen to people's questions and address them in real time and hopefully make an impact.
So this is basically a town hall. If you want to call in, this is your chance to ask any question. Ask a question of the doctor. Dr. David Aronoff is here, Director of Infectious Diseases at Vanderbilt. We have Ann on the line. Megan, hold on. We're going to take a break. If you want to call in, several lines open. There's the number, 615-737-PLUS, 615-737-7587. Take a break. We'll be back right after this.